It is okay to go for a walk or a hike or to exercise, but you really must maintain social distancing to prevent the spread of the virus, COVID-19. As we are seeing cases increase in regions throughout Pennsylvania, it is essential that we stay calm, stay home, and stay safe. We have received many questions about when we anticipate that we will see a peak in the virus in Pennsylvania and what our forecast is and how this will impact and affect our state's healthcare system. Fortunately, the answer is not simple. Modeling of infectious diseases is very complex. In disease modeling, many different factors, many different data points are considered. How it is transmitted, the percentage of people who are hospitalized, the effects of social distancing, and other issues. Now, we have been working with the University of Pittsburgh School of Public Health, and they have created a Pennsylvania-specific model. And it is based upon what we currently know about the virus, and this is the tool that we have been using in terms of our modeling forecasts. And they published an example of this last week. They and other researchers learn more about the virus, and then they update their models and their projections. And these continue to have ranges depending upon which data sets you rely on. So there have been models done by Penn for the Philadelphia area. There have been models done by the University of Washington for really all the states. And there are other models that we are examining. To put it another way, weather forecasters have different models to warn us about a potential approaching storm. It might turn into a blizzard. But if the wind changes direction, or the temperature changes, even a few degrees, it can make a difference between 2 feet of snow or some light flurries. In our case, we are learning that the percentage of people in the United States who need hospitalization because of COVID-19 is lower than that was seen in China. Differences like this can change how the models are interpreted. So we are working with the University of Pittsburgh, and they are updating some of the information in their model, and we are waiting for those results. And then we'll need to see the impact, of course, of the governor's mitigation efforts, the prevention efforts, such as the school closures, the closure of non-essential, non-life-sustaining businesses, and now the stay-at-home orders, which could significantly impact the models. This is what we do know. If we do not all stay home and stay safe, then we will see the worst case scenarios in all of these models, including the potential overwhelming of our healthcare systems. That is why the governor's mitigation and prevention efforts are so important. Here are my daily reminders. Please wash your hands with soap and water for at least 20 seconds, or the time it takes to sing Happy Birthday twice. Or use hand sanitizer if soap and water are not available. Cover any coughs or sneezes with your elbow, not with your hands. Try not to touch your face, especially after touching surfaces. And clean surfaces frequently. Practicing these everyday prevention methods can help slow the spread of the virus, COVID-19. If you have questions about your health, please contact your healthcare provider. If you need mental health resources because you or someone you know is experiencing a mental health crisis, please contact the crisis text line by texting PA to 741-741. For the most reliable information related to Pennsylvania's response to the COVID-19 pandemic, please visit our website at health.pa.gov. And what is most important for Pennsylvanians to remember is stay calm, stay home, and stay safe. And now I'm pleased to answer questions.
Thank you, Secretary. From WNEP, if a company has an employee that tested positive for COVID-19, is that company required to shut down even for a brief period of time?
Well, thank you for that question. So first, we're going to make the assumption that this is a company that is allowed to stay open in the first place according to the essential or life-sustaining business orders from the governor. If an employee tests positive, then that employee will need to stay in isolation, either at home or if they need medical care in the hospital. And then there are specific criteria from the CDC in terms of their recovery about when they can be released and go back to work. In addition, those close contacts to that employee that tested positive would need to be quarantined for up to 14 days. Now, after that same day, a deep cleaning according to the guidelines that the CDC has implemented and that are available on our website, then the business can reopen and people can come back to work.
Secretary, as a follow-up, does there seem to be any correlation between the number of people who received influenza inoculations and who subsequently did or did not test positive for COVID-19?
No, there is no correlation.
We have several outlets, WTAE, WPXI, and WESA, asking about Brighton Rehabilitation Center in Beaver County. Brighton has 19 confirmed cases of COVID and 2 confirmed deaths. Will the facility be forced to shut down and transfer out patients? What measures are being considered for staff and unaffected patients?
So I can't comment on the specific facility, but I can tell you that we are certainly very concerned about cases in nursing homes, personal care homes, other assisted living homes, and other long-term care living facilities. These are some of our most vulnerable individuals in Pennsylvania. And so our department is investigating very closely any outbreaks, certainly any deaths, and then working with the nursing home according to our guidelines to take all measures to protect patients and staff in those facilities.
Secretary, from the Delaware County Times, how are people being chosen for testing? Is it true that even if you have a physician's script, if you're not showing symptoms at the time you go, you will not be administered the test?
So there are a number of different ways that testing is occurring in Pennsylvania. We are prioritizing certain populations for testing at our laboratory in Exton. Those might include symptomatic healthcare workers, those vulnerable populations such as in nursing homes or perhaps in hospitals. But then, of course, many hospitals and health systems themselves are testing either at their own laboratory, and the test is being performed there, or they're sending the laboratory specimens to commercial laboratories such as Quest and LabCorp. And then finally, we still have the mass testing sites, which are drive-in sites in Montgomery and Philadelphia County. You can go online and make essentially an appointment and then drive through. In that site, really they're looking for patients who are symptomatic, and overall we are recommending that symptomatic patients be tested and not patients who have no symptoms. But if you have a doctor's order, I would think it would be unusual for a laboratory at a hospital or health system to turn you away.
Secretary, from Spotlight, PA, how is the state gauging compliance with mitigation efforts? Through anecdotal observations like empty parking lots, or is there a way for the state to be more precisely able to measure how often people are leaving their homes?
Well, as the governor has said many times, the governor and the administration trust Pennsylvanians to do the right thing. And the right thing now is to stay at home. And that is the best way that you can protect yourself and the best way you can protect your family from COVID-19. Now, we're not looking at maps or anything to test the compliance, but we are talking to county officials and law enforcement, Pennsylvania State Police, et cetera, and getting an idea about the compliance in certain areas. And overall, really, I think Pennsylvanians are doing the right thing, and especially in those counties that have the stay-at-home order, they are staying home.
We have multiple outlets asking about the expansion of the stay-at-home order in terms of how the counties were selected. We have Somerset and Cameron, which have 2 and 1 confirmed cases respectively, Forest County, which does not, and then, say, Fayette County was not included. Could you speak a little bit more on how those decisions were made?
So there are a number of factors that we consider when we discuss with the governor and he makes a decision about the stay-at-home orders. It can include the number of cases that we are seeing. It could include the number of cases, quote unquote, per capita, which is per 1,000 people, or as our epidemiology team looks at the data, the rate of change of cases. But also we're taking into consideration the recommendations of people in the county, perhaps their county officials or their state representatives in terms of what they feel is best for their county. And all of those factors are going into the governor's decision.
From WTAE, many Pennsylvanians have second homes or cabins in the northern or mountainous parts of the state that need to be maintained now that spring is here. What is your guidance from the state on traveling to perform routine maintenance on second homes?
My recommendation is please stay home where you are. And I know that's really difficult because I'm sure people want to go and check in their properties and do that routine maintenance. But as you were saying, this is routine maintenance. And right now, we are in a global pandemic, and I can't stress that enough. This is an emergency. That's why the governor had a disaster declaration. So under these circumstances, please stay home.
Secretary, from PBS 39, the percentage increase of statewide cases reported today was the lowest so far, 18.5%. Is that significant, or does it tell us anything?
Well, we are watching that data really carefully, and we have noted those trends as well. And so what we're watching is to see if this is a consistent trend over time that is continuing. But it's too early to draw any specific conclusions, but I can guarantee you we're watching the same data very closely.
As a follow-up, WTAE in Pittsburgh is saying that we're not seeing exponential growth in the new cases in Allegheny County. Can you give us some more context as to why that is? Is social distancing working? Is testing capability not where you'd want it to be?
No, I think the testing capability is the best that we can possibly do, and I think that we are testing the right people at the right time. We are not able to do the population-based testing that had been done in some other countries. That testing capability is not available, but testing symptomatic patients is available. No, I think that we are not seeing the quite the exponential rise and the doubling that we had seen before in certain areas. And again, we're going to see if that trend continues over time, but it's too early to draw any specific conclusions.
There have been several outlets are asking us about reports that pink eye is a symptom of an early symptom of COVID-19. Could you comment on that?
So many viruses will cause a viral conjunctivitis or a viral reddening and inflammation that could look like pink eye. So I don't think that that's a specific common symptom of COVID-19, but it's possible.
And then from the Scranton Times, is the state or anyone doing contact tracing looking to check who someone who tested positive, who they came in contact with, and why or why not?
So we are doing contact tracing for specific vulnerable populations. And so for example, in a nursing home, we would want to look very carefully at who had close contact with someone that might be positive, whether that's a staff member or a patient, and then making sure that the right people are isolated that are positive and the right people are quarantined who've had close contact. But with over 4,000 cases, we are not able to do contact tracing of every patient. It's not possible, but we're doing it under specific circumstances.
From the Lidditz Daily, you previously lived in Manhattan and taught out at Mount Sinai Medical Center, which is now on the front lines of the outbreak in the United States. What are you hearing and learning from colleagues there, and how do those insights impact your COVID-19 planning and policy making for Pennsylvania?
Well, so thank you for that question. I did train at Mount Sinai and was faculty there. That was many years ago. I actually don't have a lot of colleagues that are still there after all this time. So I haven't had some personal contacts with them, but I've, of course, been reading the articles about the situation in New York. And I think it's a very, very challenging situation in terms of the number of patients they're seeing, the severity of the illness in the patients that they're seeing, and the strain on resources. And so to me, that highlights two things. One is the absolute necessity for people to follow the prevention orders and the stay-at-home orders from the governor. We have to mitigate the spread of this illness. We have to prevent the spread of this dangerous illness to avoid a very large peak like they're seeing in New York City, which could overwhelm any healthcare system. The second, however, is that we are preparing. So we are working with our county and municipal health department partners. The Department of Health is working with the Pennsylvania Emergency Management Agency, and we are all preparing in terms of space considerations and beds, in terms of supplies, in terms of staffing for a potential surge. But the best thing would be to prevent that from being in a very large surge, and that highlights the prevention efforts and the stay-at-home orders.
Secretary, from the Philadelphia Inquirer, how many extra medical staff does the state hope to line up from volunteers, retirees, et cetera? In a perfect world, how many more medical staff would the state like to have working?
Well, we're looking at many different factors in that, as I've been talking about today. And so what we're hoping is that we will not need the type of staffing that would be necessary for surges such as we're seeing in New York because of the firm guidance from the governor in terms of these prevention stay-at-home orders. But we are looking for medical care volunteers and retired physicians and nurses and other healthcare personnel. We're working in terms of the Department of State's rules. I think the governor outlined this in terms of medical students and nursing students, et cetera, to buttress the staffing that will be necessary to deal with a surge.
From the PLS reporter, has there been any clarity given to the state, local health agencies, and hospital systems about accessing federal stimulus funds earmarked for public health? Are those funds expected to fill the need which exists among those entities?
So we are expecting the stimulus money. I know the governor has spoken about this over the last number of days. I personally don't know the details of when they expect stimulus money to come in. I know that the governor and the signed legislation for $50 million to help our hospitals in terms of the supplies that they need, and we're looking and purchasing N95 masks, other personal protective equipment and ventilators, et cetera, to make sure that our very courageous healthcare providers have the resources that they need to take care of patients.
As a follow-up to that, a reporter is asking who is in charge of dispersing those federal dollars or making decisions about the disbursements.
Well, the governor is responsible with the administration in terms of the dispersal of that federal money, and the governor and the senior staff will be having those discussions.
We have several reporters asking questions about masks. Given the CDC is considering changing its guidance to encourage the public to wear face masks, should all Pennsylvanians begin wearing masks, and if so, what kind?
Well, so we're observing the CDC's discussions. We're having our own discussions. I don't have a specific recommendation at this time. I think what's important to remember, and what has been messaged in other countries, is that, and now we're talking about cloth masks. The N95 and those type of infectious disease masks have to be for healthcare providers on the front lines. But for cloth masks is that my mask protects you, and your mask protects me. If someone is potentially having very mild symptoms of COVID-19, if they wear a mask, it could prevent large droplets from being dispersed into the air, and that would protect you. And for you, it would be the same for me. But we have not made a decision, but we're observing what the CDC is doing really carefully.
From the Pittsburgh Tribune Review, medical technology company Abbott announced that it would be making rapid COVID-19 tests available to healthcare providers across the country. Are any healthcare systems in Pennsylvania being considered, and when might the Pittsburgh region or other hard-hit parts of the state receive these tests? Are there any drawbacks to rapid tests?
So it wouldn't be us purchasing the tests for the healthcare systems. They are, of course, free to purchase those tests and those testing platforms, as they have done with others that have been produced. I think the advantage of those is that they are much faster, so they could be a very good use in an emergency department. I think that we need to look very carefully at the testing in terms of its accuracy, but I think overall it would be a good thing. But it's not us providing it to them. It's their decision whether they want to purchase those testing platforms and then implement them in their emergency department.
From Penn Capital Star, what can you say about the supply chain for nursing and personal care homes? Are they adequately equipped with masks and PPE? What is the industry's overall preparedness?
So we are working really carefully every day with long-term care living facilities. So that, of course, would include nursing homes. That would include personal care homes and assisted living homes and others to make sure that they have the resources that they need to take care of patients. These are some of our most vulnerable citizens in Pennsylvania, seniors, those with chronic medical conditions, and we have specific guidelines both for long-term care living facilities such as nursing homes, but also personal care homes, and we are reaching out to them and helping them when and if they see cases of COVID-19. So we're doing everything possible to make sure they have all the resources they need to take care of patients and prevent an outbreak.
From News Talk 104.1, yesterday the governor said we needed 2 months. So for the next 2 months, what are safe activities for people to do outside?
Well, over the next 2 months, you could do activities where there is social distancing. So going for a walk, going for a hike, going jogging, going bike riding, but not having 25 or 50 people all walking together. Like, there are fun runs and fun walks and things like that where people are congregating together. That would be counterproductive. But going for a solitary walk or hike or bike ride, etc., would be fine. Taking your dog for a walk, but not going on with 5 other people taking your dogs for a walk.
And then as a follow-up, is the state health system running short on the drugs used to induce comas in order for patients to go on a ventilator? And as a follow-up, if so, are those drugs available through federal stockpile?
I have heard no reports that health systems are short of those medications, and I'm sure there are some supplies from federal stockpiles, but we'll check into that.
From the morning call, can you respond to the written request from state lawmakers to you and the governor from districts in the Poconos asking that something be done about the advertising of short-term rentals that are coronavirus-free, as well as stopping bus lines from making trips in New York or New Jersey? So
we know that that many of the bus lines have stopped those trips, and they've done that voluntarily, which is a really good sign. And I know that the governor and the governor's office are discussing that issue in terms of individuals from New York or potentially New Jersey coming into the Pocono area and the concerns, and so I know those discussions are ongoing.
From the Scranton Times, is there any change regarding projections about Pennsylvania having enough beds?
Well, we are watching really carefully how many total beds we have. We're watching how many intensive care beds we have. We have 3,400 licensed ICU beds. Approximately 40% are still available, so we have no current shortage of beds. But we want to get more granular than that. We want to know what it is in different regions, and so we're looking at that. Same in terms of equipment such as ventilators. So we have an internal dashboard of all of those factors, and we're watching them every day. We're talking with hospitals and health systems. We're talking with county and municipal health departments, and we want to make sure that we have the resources available to deal with the potential surge of cases, which we expect to come.
We have questions from the Reading Eagle and Altoona Mirror about our data reporting. First, from Blair County, that the count changed from 6 to 4. And then secondly, a death reporting from Berks County Coroner's Office reporting a COVID death, but it's not yet reflected in the numbers.
Well, two things. First, our numbers are as they are at 12 midnight. And so you have to have a cutoff somewhere. And so our cutoff is at 12 midnight. So we're reporting today the numbers that we saw at 12 midnight. If someone tragically passes away at 10 in the morning, that would be in tomorrow's numbers. It wouldn't be in today's numbers that we release at noon. We do hear from hospitals and health systems sometimes that they have the wrong address for someone. So if someone has COVID-19 and we're tracking the county that they live in, that data constantly gets perfected. And so if we thought the person lived in County A, but they live in County B, then we make that change, and that's how a county's count could go down. It didn't actually go down. The person lived in another county, and we fixed it.
And then from Penn Live, has FEMA activated the state's refrigerated trucks to go to hospitals to hold bodies of deceased COVID-19 patients? Did the state request that, or is that something that FEMA is automatically doing in anticipation of an increased death toll?
I actually don't know the answer to that question, so that would be something I'll be discussing today with Director Padfield, who's the director of PEMA, the Pennsylvania Emergency Management Agency.
And then we have a question from WNEP. Now that mosquitoes are out, can they transmit the virus if they bite an infected person and then bite someone else?
No, that's not how it's transmitted. It's transmitted through respiratory droplets in the air.
Okay. Thank you, Secretary. That is all the questions that we have time for today. If we were not able to follow up with your questions, either the Department of Health or the Governor's Office will follow up later today. Our next briefing will be tomorrow. Thank you so much.